Hey everyone, welcome back to the channel. Today we're diving into a crucial autoantibody in the world of rheumatology, Anti-Scl-70, also known as anti-topoisomerase I antibody. This marker plays a major role in diagnosing and managing systemic sclerosis, especially its more aggressive form. Before we begin, this video is for education and inspiration only. It's not medical advice. Be sure to consult a healthcare professional and double-check information with trusted sources. Let's get started. Anti-Scl-70 is an autoantibody that targets DNA topoisomerase I, a key enzyme that helps manage DNA supercoiling during replication and transcription. When the immune system mistakenly attacks this enzyme, it reflects an underlying autoimmune condition, most notably systemic sclerosis. Anti-Scl-70 is highly specific for diffuse cutaneous systemic sclerosis, or DCSSC. Its presence helps us not only diagnose the condition, but also predict how aggressive the disease may become. It's closely linked to internal organ involvement, especially interstitial lung disease. Topoisomerase I isn't harmful in itself, but the autoantibody indicates ongoing immune dysfunction. In systemic sclerosis, this leads to fibroblast overactivity, vascular damage, and progressive fibrosis of the skin and internal organs. You'll find anti-Scl-70 in 20 to 40% of patients with systemic sclerosis, more commonly in the diffuse subtype. It's rare in limited cutaneous scleroderma and almost never found in people without the disease. Anti-Scl-70 is primarily associated with diffuse cutaneous systemic sclerosis, interstitial lung disease, often with fibrotic features. Occasionally, pulmonary arterial hypertension, especially if lung involvement is advanced. In clinical practice, anti-Scl-70 is part of the extractable nuclear antigen panel. It has a high specificity, up to 100% for systemic sclerosis, but only moderate sensitivity. This means that if it's present, the diagnosis is very likely, but if it's absent, we can't rule out the disease. This antibody is more than diagnostic, it's prognostic. Patients with anti-Scl-70 tend to have a faster disease progression, greater risk of lung fibrosis, and often a worse overall prognosis. While it's not the strongest predictor for scleroderma renal crisis, it still flags high-risk systemic involvement. Because of the lung risk, patients positive for anti-Scl-70 need regular, high-resolution chest CTs, pulmonary function tests, skin scoring, renal and cardiac surveillance. Management should be multidisciplinary, involving rheumatology, pulmonology, and sometimes cardiology. One key point: anti-Scl-70 titers do not correlate with disease activity. That means we don't use levels to track treatment response. It's a binary diagnostic marker, positive or negative, and must be interpreted in the context of the whole clinical picture. Anti-Scl-70 targets topoisomerase I and is a key marker for diffuse systemic sclerosis. It predicts more severe organ involvement, especially lung fibrosis. It has high specificity, moderate sensitivity, and strong prognostic value. Regular monitoring is essential, but remember, titers don't track disease activity. If you found this video helpful, don't forget to like, subscribe, and share it with your colleagues. For more deep dives into autoimmune and rheumatologic disorders, stay tuned. And as always, keep learning and stay curious.